For the rest of this hour, we welcome back Dr. Kevin Kavanagh of Health Watch USA. Dr. Kavanagh, good morning.
Good morning, Scott.
We've got several things to talk about, and let's begin with the top of the news as it refers to the coronavirus, or seems to be. We've already had one listener text in mentioning this, a retraction of the story about hydroxychloroquine.
That's correct. That was published in The Lancet. It was a retrospective study, 96,000 patients. They analyzed data from those patients, and they found no effect. That, to me, raised a little bit of a red flag, because 96,000 patients is a huge study to crank out in just a month. So that was retracted. The authors were not able to provide the data to have other people look at it, and thus the Lancet has retracted the paper. That is an unusual act. And we're going to be seeing that some in the research that's coming out, because there's so much research coming out so quickly that the normal checks and balances just are not as efficient. Now, at the same time, however, another research paper came out in the New England Journal of Medicine. This one was a prospective randomized trial, which is a stronger type of a research design. And it looked at hydroxychloroquine in patients who were exposed but have not had any symptoms. In other words, this was before they developed the infection. And this was a negative study. It did not help. So there have been many, many studies now on hydroxychloroquine, and two of which I know are withdrawn. One was in support, one was showing that it was not effective. But of all of these studies, I cannot think of any which shows that it works. And one of the problems that I have is that we're investing an awful lot of our time in this one drug. We only have a limited amount of research capabilities, and we could be looking at other drugs, other drug combinations that have a greater chance of working.
Let's detour for a second here, because let's talk about how the system works in terms of research, because I see and I'm not sure if this is happening in medicine or not, I see in other sciences what once was a fairly established system of the researchers take their data and they write their papers, and then it is what's known as peer-reviewed. People who are experts in the field, who really know their stuff, go through that paper, and they say, yeah, this looks good, let's publish this, and then it gets published in some scientific journal for that particular field. What's happening lately is something called pre-pubs, which is that these papers, before they are officially vetted and published, are being published online for the whole world to see, and people get ideas from that that later have to be, like in this case, retracted. Is that kind of thing happening in medicine?
Well, yes, and that makes it hard for, I think, the public and the papers to go through this research. I mean, this is kind of what Health Watch does. We review papers. I'm an associate editor on the Journal of Patient Safety. I'm reviewing large national grants next week. Our group is really experienced in doing this. So when it's a pre-publication paper, we put it through a review or vetting process ourselves. But even some of those papers, when they get into journals, such as the one that was recently retracted in New England Journal of Medicine, and there was another one retracted in The Lancet, these are top journals, but they are going through a very rushed review process and a rush to publication, and this is causing some errors to be published. Now, I should add that even with the normal process, as many as 50% of the research articles have integrity concerns. In other words, you have problems with the results of the research. And so the number is quite high, and that's what Health Watch has kind of made its reputation on nationally and even some internationally, of going through a large number of papers on the subject, weeding out which ones are good, which ones are not, and then coming up with a conclusion. And if you look at results from papers, even ones that are in the same direction, they will vary widely. And so there's a whole area of scientific study called meta-analysis that will look at these papers, look at the degree of variance, graph that out, and come up with a judgment of where exactly the true finding is most likely to be. So it's a very complicated thing to do. So the idea that we're seeing of the news media or whatever picking up one headline from one pre-publication and then all of a sudden saying, oh, this is it, great news, let's change our policy, very, very dangerous. And I think the latest example of that we had was the Stanford study, which had the lowest fatality rate of any study that I've seen so far, and there have been many. There wasn't a meta-analysis done. There wasn't a good look at research integrity. And that study, it was in pre-publication now, has a lot of questions surrounding it. So you've got to be very careful on grasping these things. And I'll be honest with you, when you weed out everything, there's also a rule that comes up quite often in the medical literature of just common sense. And that means, for example, with fatality rates with this virus, when you're starting to see makeshift morgues, vans parked outside of hospitals to store bodies, mass graves in Brazil, you know it's not the flu. And common sense needs to go into a lot of interpretation of these articles also.
Both Brazil and Mexico seem to be the current global hotspots for the disease.
Yes, and I'm very, very worried about this because even if we get it under control in the United States, which right now is unlikely because of the social unrest that we have, those are going to serve as niduses to reinfect our population later on in the year when it starts getting very cold here. And so this is of concern. And as we've mentioned before, we're also concerned about lasting immunity with this virus. It's a coronavirus. And in Sweden, a study there out of the university, and they used their own type of antibody test that they developed, so I believe it's a reliable test, found only 7.3% of that population that was immune, and that was as of late April. So there is some question there regarding immunity, and that is why we really need to wear masks. We need a social distance. And really the good news is we know how to defeat it. We may not be able to know right now how to cure the virus, but we know how to keep you from getting it. Social distance, use masks. If everybody did that, stayed at home for a couple of weeks, this thing would almost go away and then could be cleaned up with contact tracing. So wearing masks helps to prevent you from spreading it. If you're an asymptomatic carrier, it doesn't necessarily protect you from getting the virus. Social distancing will certainly greatly help in having you acquiring the virus, so that there are steps you can take to really decrease your chances of getting this thing. And if we all did this as a society, the epidemic would burn out. And that's something that's very frustrating for me. We know how to defeat the virus. It's just, will we have enough social fortitude to do it?
Dr. Kevin Kavanagh of HealthWatch USA is with us on this portion of the program. And Dave, good morning. You're on 97.3 FM WVLK.
Good morning. I wanted to ask Dr. Kavanagh, did I hear him right, or did I miss something? That if we just stay locked down for another 2 or 3 weeks and people don't go anywhere, that this thing would be over. Is that what you're saying?
Well, it wouldn't be entirely over, but the idea was if we had a good lockdown and the national deaths decreased to around 10 per day, that those could then be cleaned up with contact tracing. Unfortunately, we did not do that. We had a number of people, of course, go out, demonstrate, and you also have to have frontline workers that still need to keep food going and the economy going that didn't have proper protection and PPE available. So yes, that's what epidemiologists are predicting, that if you did this for 4 weeks, got everybody to agree on this, that this would all but go away. When you look at Sweden, one of the things that really impresses me is that most of their advisories are just that, they're advisories. They advise people to not travel. So over Easter weekend, travel was down by 90% in that country with just an advisory. In the United States, we cannot get enough people to agree on anything. And there are a number of rumors going around the internet. There's a lot of misinformation. Carnegie Mellon University has done a study and feels that these are run by bots, at least 50% of these tweets that are going around. And there's some suspicion that foreign governments are behind it. So it creates a lot of confusion in our populace. And that's why it's hard for us to do a lot of coordination right now.
So that being said, and I accept what you're saying, please don't, I mean no disrespect. That being said, in the future, does that mean every time that there is a bad flu that we shut the country completely down and that will solve it? What bothers me about that scenario is we didn't do it with the Hong Kong flu. We didn't do it with the H1N1, and we didn't do one with the swine flu. We have never reacted ever to a pandemic in this manner of shutting the economy completely down by everybody staying home. That's what I'm baffled by, Dr. Kavanagh.
Well, I think that's because of the perceived risk of this virus. And I hate to go into that because every time I do, you're called alarmist or it's too depressing. But the potential for this virus to wreak havoc on the population is much greater. I know people concentrate on deaths, but you also have to talk to people that have survived this virus, and they can have lasting problems. And how long lasting is just isn't known. The other thing that bothers people about this virus is that immunity may not last. In other words, you may get hit with this again and again and again, year after year. So this is perceived to be right now and felt to be much more dangerous than the flu. And the flu is not benign. I mean, that is a dangerous infection. So let's not, say, oh, it's just the flu. This is the flu on maximum steroids. And when you get into, well, should we let this run our population or should we shut down the economy? That's a decision for the leaders based upon what they perceive the dangers are to the public of this infection. And the dangers are high. Yeah. And what we haven't seen in Sweden is immunity starting to develop in their population enough to stop this epidemic. So just talk to people that have survived this and they'll tell you that this is one bad infection and they're still grappling with symptoms afterwards. Now, granted, you can have an asymptomatic or mild infection, but we don't even know if those people will have lasting types of immunity because they may not have had a big antibody response to that type of infection when it's really mild. And I should also add that children under the age of 1 that don't develop antibodies are very susceptible to this. And I believe in Kentucky, we've had 1 death already.
Yeah, 9-month-old.
Yeah. So the key is if you detect it early enough and snuff it out with case testing early on, then you wouldn't have need to shut down the economy on the get-go. And that's what didn't happen up in Washington and why the delay in February was so bad for us in the economy. When we shut down the economy was after the house was on fire and burning down. And so that is devastating. I will admit that. And the decision to open up the economy has to be made by the leaders. I mean, I have no more opinion on that than anybody else does, because you've got to weigh economics versus health. But I primarily will talk about the health of the virus and how to try to keep people safe and from getting it.
Okay. Well, is it not true, though, that Dr. Fauci is the one that did not recommend that this happen? That his words were, it's not as big a deal as it's turned out to be. I mean, I'm paraphrasing, but on Fauci's recommendations, there was not the recommendation to shut it down and to do that testing.
Testing wasn't done on the front end because of the availability of the tests. What I heard from Dr. Fauci during the Senate hearing was that he doesn't recommend economic strategies. That's up for other policymakers. Because you do get to a point where after the economy has shut down enough that, hey, we need to get our service lines back up and running. We need to get our schools back up and running. We need to get our food supply chain back up and running. But I need to tell you that the economy is not a switch. the policymakers can't say, hey, we're going to open up the economy, because a large portion of the income which goes into the economy and is the income that can be spent are held by people above the age of 60. And they're still scared on going out. Anytime I see someone who doesn't have a mask on, I'm hesitant to go into that retail establishment. I'm very high risk, over 65, so I'm still mostly sheltering at home. And so just because you say we're going to open up the economy doesn't mean people are going to all of a sudden go back to normal. It will depend upon the risks that they have. And if you have hypertension, you're overweight, you have heart disease, you're elderly, then you're at high risk for this disease, and you may not be really eager to go back and start shopping again or going to a movie or to a restaurant. So we need to start doing things differently.
Kavanagh, thank you so much for being with us, as always.
Thank you, sir.